Hello, everyone from Autumny, Berlin. My name is Manon Grube, and some of you will know me. My new home base, as some of you also know, is Ashoka University in India, and I'm very happy to present you today my newly joining PhD student, Arijit Bhattacharya, who in his master's project started working on what he's presenting today at NIMHANS with Professor Suvarna Alladi. And we will continue this work as a collaboration. And I'm much looking forward to what comes out of this project further. Over to you, Arijit.
Thank you, Professor. Hello, I'm Arijit Bhattacharya, a PhD scholar at the Department of Psychology, Ashoka University, in collaboration with the Department of Neurology, National Institute of Mental Health and Neurosciences, NIMHANS, India. Music and Memory. Music is a USA-based non-profit organization that has helped individuals living with different cognitive and physical conditions to deal with their impairment through the use of personalized music. Music-based non-pharmaceutical interventions has demonstrated positive impact on the overall quality of life for the people living with dementia. The idea behind this intervention is that the emotional connections associated with music will aid the recall of the memories that were formed before the dementia set in. And within USA, the Music and Memory Program has helped a large number of individuals, more than 1,000 people living with dementia, to reduce their depression related to dementia through the non-pharmaceutical intervention of Individualized Music Program. The objective of the study is to demonstrate the feasibility of an adopted version of the Individualized Music Program for the people living with dementia in India. We aim to demonstrate the feasibility of an adopted version of the Individualized Music Program for the people living with dementia, and to show the evidence for the positive effect of music-based non-pharmaceutical intervention for the Indian population with dementia. To do so, in our research design, we have first adopted the music assessment questionnaires and playlist impact assessment questionnaire from the Music and Memory organization, and further modified the questionnaires for the Indian version. That recruited clinically diagnosed dementia patients from the Department of Neurology in NIMHANS, and so far we have recruited 14 patients with clinical dementia. We have assessed them with various cognitive assessments, including Addenbrook's Cognitive Examination, ACE3, Clinical Dementia Rating Scale, CDR, Cornell Scale of Depression in Dementia, CSDD, and Geriatric Depression Scale, GDS. We had prepared a personalized playlist for the individual patients based on the music assessment questionnaire, which has consisted more than 15 songs from the early childhood, school life, and college life. We have set in a weekly follow-up with the patient and the caregiver to monitor the progress. And finally, a 3-month follow-up along with the playlist impact assessment questionnaire and reassessment of ACE3, CDR, CSTD, GDS to understand the effect of the individualized music intervention on their cognition. In Figure 1 and Figure 2, we have kept all the cognitive assessments and music assessment questionnaires. As per the results, we have found a significant difference in the pre and post depression score after the intervention. In CSTD, the significance level in p-value is 0.010, and in GDS, the p-value is 0.047 through t-test. The patients have also reported to feel less bored and more happy after the music-based intervention. The caregivers have reported that the patients started spending a good part of their leisure time in listening to the suggested songs from the list. Majority of the patients showed a reduction in agitation and restlessness by listening to the music. 1 out of the 7 patients have also reported that they felt simply more relaxed during the listening times. In Figure 3, we have showed the significance in both CSTD and GDS. In the pie chart, we have demonstrated that nearby 60% patients started showing a high response when they were asked about their early childhood memories and school life and college life while listening to the music from that time. Whereas there is another 14 and 28% people who showed moderate and low or no response. So from the study, we can see that music and memory program has showed a positive impact on the patient's life as well as on caregivers. There is a significant decline in depression level after the personalized music intervention, and the patient started remembering their teenage, school life, and college life memories. Patients' agitation and restlessness has reduced, which has supported the previous research work on music and memory at the USA population. While the study is still ongoing, the findings so far clearly demonstrate that the individualized music program is feasible and useful in Indian population with dementia. And it also suggests that the theme cross-culturally in the wider sense. Last but not least, I'd like to thank all our research participants and caregivers for their cooperation and time during the study. We'd like to acknowledge the Music and Memory Organization for helping us conducting the study and for providing us all the required materials and training for the program. Thank you.